California North State College of Pharmacy, a school with a mission to advance the science and art of pharmacy. Karen is completing her first semester here, where she is studying to become a professional in this pharmaceutical field of healthcare involved in saving lives and improving one's quality of life. Unfortunately, this same practice of medicine is associated with thousands of injuries each year due to medication errors that could have been easily avoided by correctly educating these patients on the use of their medicine. According to the Institute of Medicine, medication errors are estimated to account for at least 7,000 deaths in the United States alone each year. This comes out to almost one death every hour of the day and does not take into account the instances occurring in other countries around the world. In the summer of 2009, Karen's mother was victim to error in her medication regimen that could have led to serious consequences had a pharmacist not intervened, an error that could have been avoided had she received a consultation to educate her on her medicine. Hear Karen as she shares her mother's story with Jesse Chow and her thoughts on what could have been done to have avoided this mishap.
So, Karen, tell me about what happened in the summer of 2009.
Last summer, my parents had gone on a trip to the Bay Area to go shopping for things for my engagement party. And as my mom had come back, she had, and everything was great. She had gone to sleep and woke up the next morning and woke up having flu-like symptoms, feeling like she was sick, just like a basic flu. Didn't have energy, couldn't get out of bed. So we just assumed that, while she was in the Bay, she must have just gotten a virus or something and picked something up. So, she had gone through all the symptoms and such, and so a couple days went by and she wasn't normal. Like, she just continuously kept getting worse. It was a Saturday, and I remember I'd come home, and my mom was on the kitchen floor, just laying there. I freaked out and was like, what is my mom doing on the floor? And she was like, I can't breathe. And I cannot tell you how my heart just sank. I don't think I've ever been more scared in my life to see my mom in that condition. But unfortunately, she had something much worse. She had a blood clot in her lung and had to be admitted for a few days to allow the blood clot to dissolve and for her blood and her lungs to be fully functional again. So luckily, she was okay. We caught it at a good stage. She didn't have a stroke or didn't have anything worse happen with the blood clot. The doctor actually prescribed her warfarin, and she was allowed to be discharged after a few days. And we go home, and we actually drive to the pharmacy as we're going home, and we go into the pharmacy to pick up our prescription. But as we get there, the pharmacist didn't really seem concerned about the drug. My mom asked if there was anything special she needed to do, and no one really said anything. We didn't really think of asking for a consultation because we just assumed that she was okay because the blood clot had dissolved. And so we go home as if nothing had happened, and we continue our life. And we started to notice that her INR levels weren't matching up with what the doctor had wanted her. We had no idea what was going on with her health. We didn't know why her INR levels weren't matching up, her blood levels, why she wasn't having any energy. We were just frustrated and didn't know what to do. As a last resort, I just called the pharmacist and was very blunt and said, I don't know what's wrong with my mom. She's come in many times for different prescriptions, different dosage levels, and you guys are just not, it's just not working. Is there anything else we can do to help her? That's when the pharmacist actually looked into her profile and realized my mom was on warfarin and wanted us to come in as soon as we possibly could. Me and my mom both kind of realized something wasn't right, so we rushed to the pharmacy. So basically, we get to the pharmacy, and after the pharmacist asked a lot of questions and figured out exactly what was going on, he realized her lifestyle, the way she was living when she got home from the hospital, didn't allow her warfarin therapy to actually be effective. She was taking in a lot of spinach, a lot of vitamin K, and just things that were allowing her warfarin therapy to be effective, which caused her INR levels to be crazy off the roof, as well as her energy level and just the way her well-being to be completely distorted. And the pharmacist was really appalled at the fact that we didn't get a consultation, and now realizing how effective and how potent this drug is, the fact that no one even considered educating my family and myself on this is just mind-blowing to me.
As a pharmacy student that will one day be a professional in this field, how do you feel you could have prevented this?
As a pharmacy student, I'm very surprised that the pharmacist himself didn't offer a consultation. But at the same time, I do think it's very important for both parties to be proactive in their healthcare. I think our field is evolving to where we are being able to be more proactive within our patients' healthcare. Our field holds a lot of potential to be more active in our patients' healthcare. But I do also want to emphasize the fact that the patient should feel comfortable enough to go in and talk to their pharmacist and demand a consultation. And the fact that some drugs are, much more potent and have more life-threatening potential, such as warfarin, being such a low therapeutic index drug, the pharmacist should have automatically consulted and shouldn't have gone out without saying. So for myself, being in this field and seeing myself as a future of pharmacy, I definitely would be more proactive and wanting to be more patient-centered and allowing my patients to feel that they are able to come and ask questions, because that's basically what we're here for. And if we need to have that open communication to allow better health for our patients and their therapy.